Hi, I'm Dr. Tim Short. I'm a practicing surgical podiatrist from Ochsner Health in New Orleans. Today, I'd like to discuss a new solution for offloading plantar pathologies. Next slide. As foot and ankle specialists, we see many patients with plantar pathologies in our practice. These can include symptomatic skin conditions and lesions such as painful hyperkeratoses, verrucous lesions, porokeratosis, to name a few. In addition, plantar musculoskeletal pathology commonly presents as well, such as capsulitis, sesamoiditis, and bursitis. These are all causing pain and more severe foot problems, only discouraging our patients from an active lifestyle. Next slide, please. As we know, plantar foot pain can occur in the forefoot, midfoot, and rear foot regions, and causes can range from dermatological, musculoskeletal, or even neurological sources. Along with the typical treatments for plantar pathologies, including debridement, topical and oral medications, as well as shoe gear changes, we typically treat these patients with offloading pads and over-the-counter devices, which frequently demand our time-consuming adjustments and modifications. In the past, we've all spent our critical clinical time hand fashioning, accommodative, and offloading insoles, pads, and other devices to effectively reduce pressure and friction on targeted plantar pathologies. Sometimes we literally carve out and cut the bottom of an existing shoe insole or over-the-counter orthotic to adequately offload sensitive and painful areas to reduce friction, even potentially preventing ulceration when considering our neuropathic and diabetic populations. Ultimately, these homemade insoles are very time-consuming to fabricate, often cosmetically displeasing, and function with limited effectiveness and longevity. Unfortunately, this only leads to more time consumption with arts and crafts and less clinical time and profitability. Next slide, please. This specialty-wide dilemma we all face has inspired a new treatment alternative that is helping me care for my patients with plantar pathologies more successfully and more efficiently. It uses the proven removable peg offloading insole design that most of us are familiar with from its use in wound care. However, these new insoles are comfortably designed for the simple use in your patient's everyday shoe gear. As you see daily as I do, patients are much more compliant with offloading modalities that allow them to wear their regular shoes. Also, these are especially helpful for those who are not compliant with other treatment options, such as post-operative shoes, orthopedic boots, or even total contact casting. Next slide, please. Again, offloading pads can be bulky, time-consuming to make, and difficult for patients to reproduce on their own. Next slide, please. Along with myself and other specialists in favor of this effective technology, the PediFix Foot Care Company is now introducing the new pressure-off customizable offloading insole to podiatrists and other specialists around the country to help them relieve patients' common plantar pathologies and even more complex issues such as diabetic hotspots, ulcers, and ulcerations in remission to prevent exacerbation and recurrence. I truly believe these insoles will help save many patients from pain and suffering caused by plantar conditions and play a critical role in the salvation of both limb and life among our diabetic patient population. Next slide, please. Pressure-off insoles will soon be available in various thicknesses and material combinations, well suited to differing patient needs. Overall, they are an effective, economical, and easy solution to common plantar pathologies. As Dr. McGuire researched and often emphasized, any offloading is helpful, and these new insoles make it easy to help my patients relieve a variety of plantar conditions. Thanks for watching. I'm Dr. Tim Short, proud to have helped develop this new treatment option. Now to address some frequently asked questions. How thick are pressure-off insoles? They are currently available in 3 thicknesses, ranging from 6 millimeters to 9 millimeters, and that's about 1/4 of an inch to 3/8 inch thick. How much can they offload? The removable pegs which create the offloading effect range from 3 millimeters to 6 millimeters. Keeping in mind, even 1 millimeter of offloading is helpful to patients. Are pressure-off insoles sold singly or in pairs? They're sold as singles, as many plantar pathologies are not bilateral, and we didn't, from a patient cost standpoint, didn't want patients to have to purchase a pair if they only need one. Next slide. How will these fit into shoes? At less than 3/8 inch thickness, they don't take up much space. We typically remove the original shoe insole to make additional room like we do with most orthotics. And many patients who need these often wear accommodative and added depth shoes. Thinner styles of pressure off insoles are designed specifically to fit in ordinary footwear. What is the lifespan of the pressure off insole? That depends on patient's weight, activity, and so forth. By their nature, the cushioning materials to make them, namely Poron, Plastizote, and EV foams, will compress over time. Most patients get several months or longer usage, at which point they should be replaced. What sizes and widths are available? There are currently 3 trim to fit sizes, currently up to men's size 15. Both regular and wide widths are available, and all are scissor trimmed to the patient's precise size and width. How can patients get pressure off insoles? Currently, they're only available from foot specialists. Non-dispensing practices can enable patient direct ordering via PettyFix on a doctor's recommendation. The goal is to have over-the-counter versions available for patients to purchase through the PettyFix retail network in the future. The goal also is to make them widely available to as many people as possible to help relieve unnecessary pain and suffering and help people with diabetes prevent hot spots and ulcerations. How much do pressure off insoles cost? The physician price currently is $14 each. The suggested price to patients is $30. Some clinicians obviously will charge less and others perhaps more. And finally, what's been the response from your colleagues? The concept has been very well received by both colleagues and patients. The idea of a device that can easily be accommodated in a regular shoe while still providing offloading measures, I believe will be a game changer.
We're going to move into some questions now, and I actually have a couple questions. I'm always interested in how ideas come to life, So one of my questions is, Dr. Short, you mentioned that you were instrumental in coming up with this new offloading device. So for you and Chris, what was the process? Like, how did you determine that the industry needed something like this? And how did you think of, we've seen this done this way and it hasn't worked, here's how we want to do it? Kind of walk us through the patient need and the solution.
You want me to go first, Chris? Yeah, so when you're in the clinic like we are every day, you tend to, just like any other occupation or profession, you tend to find and think of ways that can make your life easier, make your day flow a little bit better, cut costs for yourself and patients, and ultimately alleviate pain. So basically knowing what we had with some of the wound care products that were out there with the same type of idea, it was just kind of a no-brainer to think, well, why can't we just do that on something that fits into a shoe? Because we're constantly battling, patient compliance and patient healing and, different factors that we're up against that we're trying to make it as easy as possible for them. Not only so they get better, but so we can, see our patients get well. We've seen that with other devices in the past. We see it with surgical instrumentation. You name it, there's ways to improve things and ways to modify, certain ideas to make it more beneficial for what we're trying to accomplish. So just like we said in the presentation, really it's about doing arts and crafts in your office, right? And that's ultimately what we're doing. It's very difficult for patients to reproduce that, and it's not cost efficient for us or the patient. So that's kind of where I came up with some of the idea.
Chris, what can you tell us from like a manufacturing standpoint? Specifically, here's the question: who came up with the hexagon or whatever shape that is punch out? Like, what was the thought process behind that?
Thanks. That was actually a concept that had been developed previously, not by us. I can't take any credit for that. But Dr. Tim and myself and some other colleagues had the same idea of putting that technology of removable parts insoles into an everyday shoe insole. And that's where there was a great meeting of the mind. I'd been working on the concept for quite some time and then discovered Dr. Tim and his partner, John Powers, who had come up with this concept years before I did. And we're just the ones who can help bring it to market by having it manufactured and make it widely available to podiatrists and their patients.
I think this is going to be more something that's going to be a device that the patient can actually alter and use themselves. And hopefully, like I said earlier, the goal would be over the counter options as well. But in the meantime, I think it's just going to be something that the doctors will dispense from their office and probably charge, their fee.
So, Chris, I'm sure you get this question all the time about, how do I sell products in my practice without selling, and how do I train my staff and things like that. So over the years, what pearls have you come to know that you can share with us?
Thanks. For a lot of products, it often is a doctor's recommendation, and you stop at the nurse's station on the way out and pick up or purchase a product for your particular needs. For this device, since it has to be, ideally, it's customized for the patient, the removable pegs are removed from exact spots underneath their plantar pathologies. It works a little differently. And so the doctor is probably going to customize this product to the patient, make sure it's comfortable, and then have them walk out the door with that in their shoes. And to follow up on Dr. Short's point, we expected this would be a cash pay item. It's everybody's dream to have products reimbursed and paid for by somebody else, but realistically, that's probably not going to happen here. So it is something that doctors will either dispense from their practices, or if their hands are tied in that respect, they will point a patient to and enable patient direct purchase from petafix.com or one of our other methods. So the patient can get the product directly from us if they can't get it directly from their caregiver.
Well, and usually I find that a lot of times the products that are not reimbursable are also usually cost effective as well, because it just kind of goes hand in hand that way a lot of times.
Right.
So looking at what you presented in terms of pricing for patients, it seems very, very reasonable. I wouldn't see a lot of patients being like, if insurance doesn't cover it, it's not like this is blowing out anyone's checkbooks.
That's the reaction that we've received where we've discussed the product at the few conferences where we've introduced it. The price tag didn't seem to bother anybody. It's lower cost than many treatment modalities. Certainly other options for addressing plantar pathologies are immensely more expensive. So this is an economical as well as an efficient and effective way to resolve those types of problems without getting into these high-priced products, some of which are reimbursable, some of which are not. But so far, the idea of the price does not discourage anyone from being eager to provide these to their patients.
I was thinking as you were presenting how much I would have loved to have had this product available. I think it was like last fall, my niece had a wart on the bottom of her foot that was like the size of a quarter. And she was just in a lot of pain. And obviously, when they went to the podiatrist and went through all the necessary things. But I'm just like, dang it, for those handful of weeks where she was just in so much pain walking around, this would have been a great solution.
Yeah, we're hopeful that we can really help a lot of different problems. At one end of the spectrum, it's diabetic ulcerations and ulcers that are in remission, and people with diabetes who have some hot spots or friction areas that are precursors to ulceration. And all the way to the other extreme where there's simple corns and calluses and skin irritations and verruca and other relatively minor conditions that are painful. And this is a very simple and convenient way to take pressure off those particular spots. So it has a really wide range of applications for a podiatry practice.
This is a weird question, but I understand that, sometimes you might use these to offload a long-term condition, but sometimes you're dealing with a wound. And obviously with wounds, they can get a little nasty. So can you wash it and reuse it, or would you need to get another one when it starts to smell?
Some of the different top covers are more amenable to washing and can be cleaned quite readily. We have pour-on top covers that are a little bit easier to clean. We have a different version with a Plastizote top cover, which is a little tougher to clean. The good news is that both those types of covers are available in a replacement model. Essentially, we call it a supplemental top cover. So if they become soiled and or they become compressed, which is what happens to these materials by their very nature, a physician can order a replacement top insole only. And essentially, it's a self-adhering insole, and they can stick it right on top of the existing platform and essentially refresh or renew its cushioning capabilities and cover up any soil or dirt that might have accumulated on top of the original insole. So instead of having to buy an entire new insole just for $4, more, you can add one of these supplemental top covers, either Poron or Plastizote. It gives more cushioning for patients who might need it, and it acts as a replacement for the existing device.
Yeah, on that same kind of concept, would, and maybe you've done this, Dr. Short, would it make sense to sell these like in bulk to patients? So instead of, selling them in multiple versus, just 1, 2, or 3?
Selling them that way to the patient?
Uh-huh.
Yeah, I don't know if that would be an option or not. I mean, I guess potentially that could be an option, but I don't foresee a lot of patients really doing that. There may be a few patients that would do that. I know my patient population probably would buy 1 or 2 at the most, but that's certainly an option. And then, certainly for doctors' offices, more in bulk, and then that way they can just dispense as needed.
Right, because I was just curious, if I had like my pair of walking shoes versus my pair of dress shoes, if I would want to be switching it out all the time, or if I would get an insole for each type of shoe.
Yeah, that's
Great,
kind of
good
similar
point.
to when you get an orthotic or something too. I mean, very rarely does someone buy, more than 1 set of orthotics at a time. But I have had patients to do it. But of course, those prices are way more costly than what
Right, that's kind of what I think. Like, I certainly, if I was a patient and I was buying a $500 custom orthotic versus a $30 insert, that I could afford that. I could do that.
Yeah.
You ask a very good question, and I think we don't have that much experience dispensing them just yet, but I suspect there will be patients who recognize that in certain types of their footwear, they can use one of the thicker, more protective styles, and if they want to be in more fashion-forward shoes, that they might have to choose a different style and thickness for those, and for that reason, they may indeed be interested in purchasing multiple pairs for different types of footwear. I think it's very likely.
So obviously you're removing the different parts based on the patient's need. Do you give those parts to the patient so that when they're all healed up and all better, they can put it all back together and use it as a regular orthotic, or what do you recommend?
That is my vision, that they will hold on to the pegs, and as their pathology shrinks or disappears altogether, they can reattach them to the insole plantar surface and have a full foot insole. So that is one indication. And for that very reason, one of our different designs features a Velcro reattachment system, predominantly for that purpose. So again, as the pathologies shrink, or for any reason they didn't put the offloading in just the right spot, you can add the plantar pegs back into the bottom of the insole very readily and make it whole again.
Awesome. Are these available now? You guys have them in stock, so if doctors wanted to get started, they're ready to go?
We've sold out of our initial supply of them. I'm hanging on to a variety of styles and samples that I can show at the trade shows, and we are expecting some very significant size deliveries in the weeks just ahead. But right now they are somewhat scarce because they have proven to be more popular than I even expected, and I knew they'd be popular.
That's awesome. I love it when that happens. It's always great to sell out of a product and be able to tell somebody, oops, sorry, you'll have to wait for the next shipment.
It's a double-edged sword. I wish I had enough product to accommodate everybody.
Like, diabetic patients can't wait. We got to get them rolling.
Right. Exactly.
Yeah.
Exactly.
So yeah, I mean, that is exciting though, that obviously at-risk diabetic feet are not at, they don't seem to be slowing down at all. So producing more of these is obviously, I'm sure, a giant priority, and that's exciting.
Yeah. How long did it take from Dr. Short, your idea of like, I see this need for this product, I see a product similar to what I need, but I'm going to make it better, to you connecting with Petafix and actually bringing it to market? How long was that process?
If I had to guess, I'd say probably about 7 or 8 years.
Whoa.
Yeah, but that's just because I kind of, it wasn't in the works that whole time.
Right.
I came up with an idea, and then it takes a while to get a patent, which I worked on for a while. That was the biggest, that was the bulk of the time consuming part. And then actually, was just reaching out to different companies on my own. And in the process, I started a new position with a hospital in New Orleans, and I kind of didn't necessarily give up on it, but I kind of it was on the back burner,
Right.
and Chris actually reached out to us through one of my nurses, and she's like, they're looking to talk to you. And ironically, even I had reached out to Chris, I think in 17 through LinkedIn. So it's been a while since we just never connected. So it's just kind of one of those things.
Well, there's a time and a season for everything. I just love how things work out right when they're supposed to. So
When we do know on the back end, that we're helping communicate and make people aware of products that could potentially save limbs. I mean, that's a really big deal. So that's exciting. So thank you very much for allowing us to spread the word.